cancer survivor, currently in my 28th year, and speaking with this standard device. And before I introduce the guest speakers, I would love to share some of the important milestones. The first and foremost thing is we at ICS Delhi, you know, have achieved a commendable milestone of completing 27, yes, 27 live webinar right from July until now under the title of Fridays with Shrenik. We have had 20 cancer specialists who are rather super busy, but despite their commitment and so many priorities, they've given their time to deliver their knowledge, experience, and expertise about cancer awareness, prevention, treatment protocols, and everything. And it's like, so much go on about cancer awareness, prevention, and everything. Now, today, we are having commendable speakers. And first of all, I would like to invite Swarnima Jetli. She's from Rajiv Gandhi Cancer Institute in Delhi, having commendable, fabulous experience of 30 years. I mean, particularly in a segment of philanthropy, and she has contributed a lot. I mean, since 2007 until now. So let's hear Sonima gently all about philanthropy services offered by Rajiv Gandhi Institute, Delhi. Over to you, Sonima, and thank you for joining. Welcome on board. And Anuj and Ritika, please announce screen sharing.
Thank you, Shrenik sir. Thank you for introducing me. And I will just make a short presentation on RGCIRC. Josam ma'am, you are from Indian Cancer Society, and Indian Cancer Society is supposed to be the mother institute of RGCIRC. So please correct me if I go wrong anywhere. So I'm going to, this is a presentation. I'll just an introduction to RGCI. Anuj, can you go to the next slide, please? Yeah. So the institute was established in 1996. It was at that time, it was a 152 bedded hospital. It is owned by a society and operates on no profit and no loss basis, means whatever we earn goes back to the institute. The total area of the hospital is 5 acres. Currently, we have 500 bedded NABH accredited hospital, and we aim to provide best oncology care. More than 3.5 lakh patients have been treated at our hospital. Next slide, please. As rightly said, the vision is to provide affordable oncology care of international standard and to help to eliminate cancer from India through research, education, prevention, and patient care. Mission is to be the premier cancer care provider in India, and we preferred choice of patients, caregivers, faculty, and students by offering comprehensive services at an affordable price and excellence of our personal leveraging best technology. Values, we value our patients in high esteem and work with ethics and compassion. We care and function with mutual respect, trust, and transparency. We deliver accurate diagnosis, correct advice, and effective treatment. Next slide. So this is the brief history of RGCIRC. The very seeds were sown in 1980, and 1992, the foundation stone was laid. And between 1989, we were able to acquire the land, 2 acres of land, with the help of Indian Cancer Society. And in 1994, the another society, Indian Cancer Society Research Center, was formed. And the governing council of this society governs the hospital. And in 1996, the hospital was inaugurated by Sonia Gandhi. And by 2007, we were 302 bed. Now we have reached for almost 500 bedded. We are one of the largest exclusive cancer institute in Asia. Next slide, please. So this is the governing council of our hospital. Next slide. And this is the top management of RGC. The CEO is an ex-IAS officer, and he joined our hospital in 2007. Before that, he was principal secretary health and family welfare in Delhi government. And our medical director is Dr. Sudhir Rawal, the renowned urologist. He has conducted maximum robotic surgeries in the country and across many nations. And Dr. Gauri is a renowned pediatric oncologist who is also the director of Nitiba. Next slide, please. So this is our specialist. We have all the specialists are available under one roof. So from medical oncology to radiation oncology. Next slide, please. Surgeon, radiation oncology, and lab services. There are more than 100 consultants, 800 nursing staff, and 200 plus medical paramedical staff. Next slide. Next slide. These are just our specialist. Our strength is that we have all the facilities, as I had said, available under one roof, from prevention to palliation. So we have cutting edge technologies, which includes cyber knives, tomotherapy, robotic surgery. We have 14 OTs and 3 minor OTs. We have a first molecular diagnostic lab, and we have specialized and multidisciplinary approach, in the sense that we have organ specific multidisciplinary cancer diagnosis, in whether it is surgery, medical oncology, or radiation. We have organ-based specialists available, and we have tumor board from day one to discuss cases which are critical. And subspecialty development started in 2007, and we have ethical practices in our hospital. And the very important thing is that we have uniform pricing for national and international patients. In our hospital, there is no special pricing for international patients. So treatment begins within 24 hours of diagnosis, and philanthropic services for needy patients are available since its inception in 1996. And we have a very strong research department. We have clinical research ongoing since 1996. Rather, the first phase 1 clinical trial with Dabur was held in our hospital. And we have ICMR hospital-based cancer registry running in our hospital since 2012. We have a next generation sequencing biorepository. Biorepository is something where the leftover samples after diagnosis are stored for further research. And then we have an academic program for DNP, DRNP, and DNP. We have a comprehensive care and support services in terms of psycho-oncology, and we have a department for pain and palliative care as well. Next slide. This I have said, all services available under one roof. Next slide, please. These are the various accreditation which we have received since our inception. Next slide. So again, certification accreditations. Next. This is the statistics of the world. I just wanted to show that the number one cancer in the world is lung in males, and in females it is breast. And the scenario is going to be different in India. Please, can we go to the India? Next slide. So in India, it is breast followed by uterus, while if you see in males, it is lip and oral cavity followed by lung. Next slide. This is the burden of cancer in India. As you can see, in India, the different part of India behaves differently. So if you see that the 60% of the cancer in India are preventable, because most common cancer in India are oral, cervical, followed by breast. These are all preventable cancers. So you see different parts of India is behaving differently. If you go to south, the leading cancer site is stomach cancer because of their eating habits and risk factors. Their diet is rich in spices. If you go to northeast, it is oral cancer because they are into tobacco chewing. Similarly, if you go to Punjab side, the leading site is kidney, urinary bladder, and breast. You will not find oral cancer here because they are not into tobacco chewing. Next slide, please. This is the patient statistic of RGCIRC. I will not detail it out. It can be seen. Next. So these are the most common cancers. In male, you will see a lip, oral, followed by lung and prostate. Now, this is not being as followed by what is happening in India, because here it is also on the basis of practice. Now, Dr. Rawal is a renowned urologist. So you will see prostate cancer. We are seeing a lot of prostate cancer in our hospital. Next slide. This is philanthropy at RGCIRC. As I had said, the philanthropic activity started since inception in 1996. We are spending more than 50 crores from our own resources towards the treatment of needy cancer patients. Now we have like some services are available, just like free bed services, discount on case to case basis. We have free home care services. We have free awareness, cancer awareness and screening camps. We also get PM relief fund, CM relief fund, and we have signed agreements with a lot of NGOs to support the treatment of needy cancer patients. Like the vision of this department is that no one is denied treatment because of lack of funds. And our mission is that ensure the treatment for all. Next slide, please. So these are some of our benefactors. These are some of the organizations we have signed agreement with for helping the needy patient. And we are also getting CSR funds from organizations like GAID, EIL, ONGC, and IOCL. Next slide, please. This is some of the act of philanthropy I'm going to just talk about. Grace is a home, we call it home away from home. I call it an act of philanthropy because one child took treatment at a hospital under Dr. Gauri. And this child, the child's father is a renowned industrialist. So when he was leaving the hospital, when the patient was on follow up, so he wanted to ask Dr. Gauri, so I want to do something for the institute. So Dr. Gauri said that why don't you do something which stays with the institute, because the most common cancer in children is ALL, where the treatment is long. And for at least for 6 months, the patient has to stay close to the hospital. So this idea of home away from home started. This is a place which is close to 500 meter from our hospital. It has 16 rooms where the child, this parents, one caretaker can live this place, and this space is given to them free of cost, or they are charged minimal electricity bill or something. Now the same industrialist is running this Grace Home Away from Home since almost 10 years, and it is happening through their CSR. So this we call it as an act of philanthropy, where the administration is by RGCIRC, but it is the cost is by this industry under the CSR. Next slide, please. This is another act of philanthropy, I say, is biorepository, wherein what happened that once we got a letter from a big time lawyer, and he wanted to donate for research. So again, then we thought of setting up the biorepository, where any sample after diagnosis is left over, we use it for research. So we were one of the first biorepository in the country. Now the samples from this biorepository are sent across globe for the to help the treatment of the to help in research. Next slide, please. So this is preventive oncology. As we have said, the prevention is a very important tool. So prevention, Department of Preventive Oncology is very strong at RGCIRC. We are conducting almost 25 to 30 free awareness and screening camps per month in Delhi and NCR, and 80% of these camps are in underserved population. And till date, we have the outreach more than 4 lakh people in terms of awareness. And we have screened more than 1.25 lakh people. And the thing is that we don't screen not only to test, but we screen to treat. If in our underserved population, if we find a patient who's found to where he's found to have cancer, that patient is treated free of cost at a hospital. So as very rightly said, the only way to win battle against cancer is through prevention and early detection. So education and awareness is very important. Next slide, please. This is home care. As RGCI also running this home care services that is for terminally ill cancer patients since 1996, wherein the patient where there's no active treatment can be given at is being given at RGCIRC. And so a nurse and a doctor visit these patients, and they are given symptomatic treatment free of cost. They are also given nutrition supplement, and counseling and emotional support is also provided to the family and caregiver. Next slide. So this we can ignore. Next slide, please. Next slide. Thank you. So the Joseph ma'am, you can add in wherever you want. She is one of our founder member of RGCIRC, and she's one of the guiding force to all the philanthropy activities which is happening in our hospital. Ma'am, you are on mute.
Myself, yeah. I said it makes me very happy to see how RGCIRC has grown. And I'm very pleased that we run a very good system of assistance to Rajiv Gandhi patients, particularly to children. Yes. And to women. Our focus has been there. Uh, I think that the preventive oncology department was set up when I was the secretary, yes, of Indraprastha Cancer Society. So I have a very proprietary interest and pride in what you're doing. Thank you very much, Swarnima. Most welcome, ma'am. Your guidance is always there. We're always looking forward to you, looking up to you for your guidance. Thank you, ma'am. So I am open to any questions you have. So first question which I have, yeah.
Wait a minute. Uh, Dr. Swanima, thank you so much. It was indeed most insightful presentation. And to be precise, I love the idea of two things. That is mom away from home. That's number one. And number two is bio repository. Just give me a second. I mean, I'm having a call. Just 1 second. From a volunteer. 1 second. Yes, Tamanna. Hello. Hello.
Tamanna?
Sorry. So now, Sonima, there are a couple of questions. Number one, as regards to this philanthropy services, is it available to any Indian across India or people living in Delhi or UP?
So these services are available to all the patients who are registered with RGCIRC. So RGCIRC is seeing patients not only from Delhi, we get patients from across the country, especially we get a lot of patients from UP, Bihar, Madhya Pradesh, Punjab side. So it is available to any patient who is registered with RGCIRC.
Great. And
And he has to be an
by the
Indian
way,
citizen.
yeah, of course. And by the way, what are the basic
Criteria.
requirements, for criteria for availing philanthropy services
Yeah,
for the
sir,
patients or yeah,
I will explain you the process here. The thing is, the first the patient reaches the doctor, and when doctor gives them the cost estimate of the disease, and the patient say that they cannot afford the cost of the disease, the patient is directed to us, and we guide them through the various schemes, and we tell them about PM relief funds, and we also for all the NGOs we have signed agreement with, the criteria is that family income should not be more than 5 lakhs. Okay, this is the only criteria we have.
right,
He should be a citizen of India, and the disease should be treatable, and he should be registered with RGCIRC, and cancer should be confirmed.
right, right. And usually, what is the procedure? I mean, processing time for because giving treatment. Yeah, my immediate treatment is essential.
Sir, with the NGOs, we have signed agreement with like Indian Cancer Society, Delhi branch or Mumbai. So the procedure is, it does not take more than 1 week to 15 days. Sometimes from ICS Delhi, another NGO, we may get it in 2-3 days also approval. And when it comes to, we have CSR pumps from like GAIL or IOCL. So that is something which comes in credit. So it is an instantly available. We have a committee formed in our hospital. So it is a small committee, internal committee, which signs, approves all the papers, and then it happens within 2 days. If it is a CSR fund, it happens fast. And if it is with the NGOs, we have signed agreement that we have prepared a format in which the application go to that particular NGO, and we get an approval, and then the patient is informed about it.
Right. And another question, is there any particular limit of the philanthropy amount being offered to the
Okay, okay.
for the
So
treatment? Yeah,
this amount varies from 50,000 to 5 lakhs, depending on what the NGOs would like to give. Like ICS gives up to 4 lakhs to pediatric patients, ICS Delhi branch. So I think ma'am has
right.
put more than 2 CR for our pediatric patients. Thank you, ma'am.
And
Great.
we share
And
the every month bills are shared with the concerned organization. Whichever organization is giving us the fund for the patient, for each patient, the bills are shared with the organization. So we have kept the systems very transparent.
So, Arunima, have you put our logo on your sponsors and donors?
Yes. On our website, we have put.
On what you showed, your
Yes,
presentation?
yes, I have put that.
Please check.
great.
Indian Cancer Society, I have.
Yeah, I mean, I have seen ICS already. So
I put
that's
ICS.
fine. Okay. One last question. Sonima, the individuals who need BMT, the cost structure is too high, which is, I mean, about 20-25 days. So in that case, what are the options available, particularly for BMT?
For, sorry, for PM Relief Fund, did you say that?
No,
No,
BM,
no.
bone
BMT,
marrow.
bone marrow transplant.
For bone
Yeah,
marrow transplant,
so
with all the NGOs, ICS is not supporting us for BMT, but all other NGOs we have said, including BMT.
no, what I'm
And we,
trying to ask you is, once again, what I'm trying to ask you is, like, earlier you said it starts from 50 to 50,000 to 5 lakhs, but in case of BMP, the cost is twice, something like 20,
okay,
25
I'll tell
lakhs.
you.
So,
Sir, we are also connecting our patient to crowdfunding, wherein you can get funds through internet also. Some of our BMT patients, especially when they are young patient between, kids or young patient 24, 25. So we are able to raise funds for them. The Impact Guru is one organization with whom we connect patient because they have us, two dedicated people in our hospital. So last year, for one patient, even 30 lakhs was raised. So there are
fantastic.
two types of, yes, ma'am.
Great.
There was, the Cancer Cure Fund does support BMT.
At ICS Mumbai?
Yes.
Yeah. But
Great.
because for
That is good
BMT,
to
the
know.
cost is very high. So we connect them to crowdfunding, sir. And this is not just one fund. If they are telling them, getting them one from one NGO, we also connected them to PM Relief and CM Relief also. So we are the maximum beneficiary of PM Relief across the country. And CM Relief, especially from UP, a patient can get up to 5 lakhs. And I've seen some patient getting it twice also. So these things helps a lot.
Uh, Yeah, and in what you mentioned, is it restricted to only Rajiv Gandhi Cancer Institute or institutes other than Rajiv Gandhi as well?
No, nobody can open the door that way.
No, I'm just asking because
Yeah,
I mean, I'm coming
telling
across so many individuals.
no fund will open their doors that wide.
First, I have to satisfy the patients of my hospital. I'm still in dearth of funds. Sometimes, by the evening you feel so depressed because there are some patients we are not able to help.
Great. Thank you, Sonima, for most insightful presentation and talk. And let's move to the next speaker. Uh, we have one next speaker that is Tamanna Punjabi. She's from Delhi, cancer survivor. She's working in SL technology, and I am rather meeting her for the first time, but she's indeed a brave warrior, and so Tamanna, stage is all yours. Start sharing your journey. All the best.
Thank you so much, Shrenik. And thank you, Indian Cancer Society, for providing platforms like this to spread awareness about cancer. Like he said, my name is Tamanna. I live in Delhi. I work in marketing and communications, and I am a very proud non Hodgkin's lymphoma survivor. I was diagnosed in 2019. I was having a severe chest pain suddenly one day, and I was 24. So I figured that 2 days back I'd gone to the gym and done a chest day. So I thought maybe muscles mein dard ho raha hai, and that's probably why the pain is there. So I ignored it for one day. The next day it got worse, and it felt like something like a heart attack, but we didn't know what it was. It was just really painful. So my mom took me to the hospital. We got a few tests done. But when something like this very sudden happens, you don't do the whole body checkup because there's so little time. You want to solve the problem quickly. So we got the nugatory tests done, and we came to the fact that okay, maybe there's a lung inflammation, and the doctor gave me a few tablets and medicines, and I took those for 2 weeks, and then it settled down. So we thought theek hai, ho gaya. And then 2 weeks later I started having pain again. So but it wasn't as bad as the first time, but it was still painful. And on that day there was no one at home. My mom was at work, my sister was at work. So it was just bothering me that why am I having aches and pains when I'm only 24. So I called my mom up and I said I want to go for a full body checkup. I'll just go check what's happening. And the thing is, at that age we're just not used to full body checkups because you just assume everything's okay. And so that was my first learning out of cancer, that you need to do a full body checkup whatever age you may be, once a year. So then I went for that, and then of course then they did lots of checkup, lots of tests, and then they discovered a 10 centimeter tumor in my chest, which was between my lungs and my heart. So then of course then telling me that oh, this is cancer is a little bit scary because chota bachcha hai, pata nahi how will she take it, all of that. So it took a bit for them to tell me ki biopsy karani padegi. And I'm going to sound very ignorant, but I didn't know what a biopsy was. Jyotsna ji, are you saying something? Sorry.
No, I'm trying to mute myself.
Okay. So then they said do a biopsy, and I didn't know what a biopsy was. So on the way home, I'm quickly Googling ki biopsy kya hoti hai. And that's how I got to know that it has something to do with discovering whether you have cancer or not. So that fear sort of started. Oh my God, is this where my life is leading now? They did the biopsy, and then it took about 8-10 days for the results to come because they had to send it to different hospitals, get multiple opinions on it, and all of that. So we had our checkup the next day, and one day before, my mom and I decided we need a break, and she by then already knew that I have cancer, and so she knew that the next day I'm going to get to know that. But I didn't. So we said, let's go out for dinner, calm down a little bit before we get to know what's happening tomorrow. And the next day, we went to the hospital, and the doctor said, you have non-Hodgkin's lymphoma. And for a second, it doesn't mean anything at that time, right? So I'm like, what does that mean? And then he said, it's lymphatic cancer. You have a 10 centimeter tumor. And then he's paused for like a 10 seconds to maybe in case there's like an outburst of emotions or something, maybe I'm going to start crying or something. But I think because there was a week in the middle to acclimatize to the idea that it could be cancer, I think my reaction was not immediate. So I looked at him, I said, okay, and is it treatable? And if it is, how long is it going to take to treat? So he said, 8 months, 6 to 8 months, we will treat it. Yes, it is treatable. You will be fine. So I said, okay, then let's get to it. And then he's still wondering why she's not crying or doing something. But in my head, I had a lot of other things going on. So I had gotten through my MBA college that I wanted to go to Indian School of Business, Hyderabad. And I was like, okay, so now do I not get to go to college? Do I have to wait? So I'm asking him this. And he's wondering what a strange thing to ask when somebody's telling you have cancer. But that's what was going on at that time. And then he said, okay, I will do my job. I will make sure that you have the best treatment. But you have to have willpower. So I said, yeah, I have lots of willpower. You don't worry, you do your job. So he said, okay. And then we came back the next day. He said, you come, if you have any questions, you can ask me. And I had a list, Shrenik, of questions with 15 different questions of everything I'm going to be able to eat, do, not do, all of that. So he was like, okay. And then he answered all of them patiently, thankfully. And so 3 days before my first chemo, I had my second round of the college, and I had to go to Hyderabad for it. And I was like, okay, so now is he just going to say don't travel because now cancer ho gaya hai? So I asked him, and he said, do you really want to go? And I said, yeah, I don't want to miss the chance. If I'm getting the second round, I want to go. So he said, okay, your chemo's after that, go and come back. So then I went, and on the way back, I had a massive attack on the flight. Severe pain. My friend was with me. She was wondering what to do. And she was saying, don't take the flight. Let's just stay in Hyderabad. And I said, no, no. I have chemo day after tomorrow. I have to get to Vishakhapatnam. So we just took the flight, got there. And I had chemo one day, like I had a 1 day gap, and then I had chemo. And on that one day, I had a plan. I had waist length hair at that time. So I had a plan. I wanted to go and get it cut to this length because I have always loved my hair. And the doctor had said that you're going to lose it. So I didn't want to go through the pain of it going from that length. So I thought if it goes from this length, it'll pain lesser. It did pain lesser, but it still did ache a lot. And so yeah, so I did that, and then we started with chemo. Of course, for all those who know anything about cancer or have gone through it, know that it's extremely painful. It's such a tedious process. Um, i had skin color discoloration on everything. Hair started falling off immediately after the first chemo. My nails had gone black from within, so there was no way to cover it. But then I started applying nail paint to sort of cover it because I didn't want to see it. Um, so yeah, so that time I think is, now that I talk about it, I realize that it feels like somebody else's life or somebody else's story, even though it's only been 5 years. But just that time feels weird and very surreal because every single thing was painful. Getting up to go to the washroom was painful. Getting up to take a glass of water was painful. Just I had aches and pains after chemo in the most strangest parts of my body. Like one time I remember I had pain here in my jaw, and it's just something you don't expect because we don't even realize that we have a bone here that could pain until you get that pain. And so it was a very weird time, and I had to get a spinal injection after every chemo. And for that you have to stay extremely still because it has to go in that exact point in your body and you can't move. So the first time that we did that, of course it's not possible, so there were 5 people pinning me down to make sure that I don't move and the doctor can do that. And from the second chemo, it became like a mental process. I had earphones during that, and I would play this one song that would calm me down. Um, and I would tell everybody that only one person pin me down, because when there are 5 people doing it, you feel like you're like an animal being caged. And I didn't want to feel like that. So I said one person can be there in case they need to hold me, but I will hold myself. And I remember, I think on the fourth time that they did the spinal injection, they didn't need that one person also. So the doctor then came to my mom and said, "ये expert हो गई है spinal injection लेने में." And I will always remember that because I realized mind over matter is such a big thing. We never, like in everyday conversations, you don't think about it as much as you do at that time, because at that time I just had to control it. So I remember that as one of the tougher parts. But what I did do through it, Shrenik, was that I was blogging my experience through the journey, because I just felt like if I make it through, I want to be able to remember this. And I may not, because I realize now, 5 years on, there are so many little things that I don't remember anymore. And they are important lessons in life that I think I'm forgetting slowly. So I need to start documenting it even more now. But I did at that point through a blog, and it helped me release some of my unsaid thoughts. And it was a good release. Um, Yes, and then so I was supposed to be having 6 chemos. Before the sixth chemo, I had been very careful all along. I didn't go out a lot. The doctor said, "Don't meet anybody." I didn't meet anybody. Whoever wanted to meet me, I had to go through one whole process to meet me at home. Also, very few people. And just before the sixth chemo, when I was getting ready that, oh, this is my last chemo, after this I'm going to be done with this thing, I took a risk. I went out and contracted pneumonia. And then I was in hospital for 21 days. And I think whenever I remember those days, I think those days were tougher to me than the whole cancer journey. Because one, I think 21 days in a hospital when you're constantly just being not able to eat anything, go anywhere, do anything, 100 machines pinned to your body. Um, it's just, it for an independent person, it feels very difficult. And I went right up to death's door, I feel, because I went right into the ICU. And then they put me on a ventilator because they said, okay, this is going downhill. We don't know. They made my mom sign that waiver that we don't know if she'll make it beyond tonight. Um, but here I am. So I feel like I went right up to death's door, knocked on it, been like, hi, but I'm going by. I'm not coming yet. Uh, so that was the ICU was, I think, worst part of my cancer journey, because I just kept wondering, is this, if this is where it's going to end, then I hope it ends, because I was like, this is like hanging in the middle. I'm not getting better and I'm not getting worse, so this is worst. So I remember I was praying to God that either you remove this pain or just remove me from this entire equation, but I can't do this any longer. Thankfully he removed the pain and not me. But um, after that treatment we couldn't do the last chemo, because the immunity was so low that the doctor said chemo cannot be administered to you. So then they did a month of radiation instead. And I think, um, I mean, I think as you grow older you start worrying less about what people think, but at that point I was worrying a lot because I had to get chemo in the upper part of my body. And you have to strip completely and go, and there are like four doctors in there, uh, of course doing their job, but to you you're like, okay, now am I supposed to just be here naked doing this? I don't understand. So I remember the first time I did it, I was extremely awkward. And the doctor was like, hurry up, time nahi hai, chalo, next patient is waiting. And and I think by the third or the fourth time, it was so easy. It just became like, okay, ye to karna hi hai, chalo, let's get to it. Um, and another lesson that taught me was that everything's about sort of practice. Because if you kind of train your mind into believing this is okay and this is going to get better, you can get better, and everything does get better. So that, I think in gist, that was my cancer journey. I mean, if you have any questions you can ask, but today, now I run a podcast called Tumorously Yours. And it's called Tumorously Yours because I believe that, one, we don't talk about cancer enough, and we make it a bigger taboo than it needs to be. Second, I think we don't hear about the emotions that people go through when they're going through cancer, or even people who are caregivers or people who have lost close beloved people. So this is a podcast where I talk to lots of people that share their stories, and it's called Tumorously Yours because I don't want it to be sad sappy. I want it to be a story that you share with ups downs like all our lives are. So yeah, that was my journey.
That's great, Tamanna.
Fantastic, fantastic. See, Tamanna, when you send me text, like, send me questions, etc., I just told you one thing. I wanted to go along with the flow, talk your heart out. And initially, I mentioned that, you are a warrior and being into marketing and communication, you know your job so well. So, many congratulations. And
Thanks.
so now only one question here. I mean, is there any treatment you're following, like by your capsule or tablet or anything, or just nothing?
No, nothing. So I feel like one of the things that the doctor has said that you have to do is your regular checkups, right? So I have not missed a checkup till date. I make sure I go for everything. So at times there's been a vitamin deficiency, then they'll say, okay, for 3 months take this vitamin. or whatever, but there's no continual tablet or medicine that I take. And now it's been 5 years, so now my checkups have also become annual. So it's I'm hoping
Fantastic,
easier here on.
Are you
fantastic,
still
and
in
all
Vi-
the very best to your podcast also. Yeah, yes,
Thank you.
Jyotaji, Moliye.
I was asking, are you still in Vizag or are you taking your treatment here in Delhi?
No, I live in Delhi now.
Hmm.
I work in Delhi here. So I
Okay.
was in Visakhapatnam only through treatment.
Hmm.
And right after that, I went to study in Hyderabad. And then from there, I've been here. So I'm in Delhi.
That's great. I used to live in Visakhapatnam
Oh,
in the dark ages, I guess, compared with your young life. But it's a wonderful place, and I'm happy to know that there are such medical facilities there.
yeah, yeah. It was a very good hospital. And the doctor was particularly committed to.
Hmm.
He was a little bit, I must tell you a really strange story since you brought up the doctor. I must tell you that. So, my doctor was much older than I was, of course, and he was a little sadu. He wouldn't smile, he wouldn't say anything beyond necessary. So, and I was like, why? Like, why wouldn't you just give me a smile? I'm having a tough day, right? You're telling me I have cancer. Smile and after while saying bye or something. He just wouldn't. So I remember one time he was administering the spinal injection, and somebody else was administering, and he came to check. And I was in that fetal position waiting for it to be administered. And he walked in and he said, "So, how are you doing, young lady?" And the entire hospital staff is shocked because he doesn't say things like this. And I'm in this fetal position and I'm looking at him. I'm like, "I'm good. How are you doing, old man?" And then until date, when I think about it, I'm like, "Oh my God, what was I doing?" but it made him laugh. And I saw a smile only that one time. So I'm good.
Good, good.
Tamanna, I'm impressed. Me, I'm not surprised with this approach because you are seeing only one oncologist or one doctor at a time. He's just seeing 100 patients a day. So making him laugh is a really nice to him as well. Anyway, thank you so very much for joining, sharing your journey, commendable and fascinating journey. And we would like to move on to the next speaker as we would be running out of time. So thank you once again. Friends, let me now introduce another gentleman. Uh, my from Ahmedabad. He's a good friend of mine, and I mean, he's from finance department, controlling finance in a public limited company. So, are you there, whereby please unmute yourself and share your journey. And thank you for joining. You can speak in Hindi as well, or whatever you want.
Thank you, Shrenik bhai. And really, Tamanna ji is a brave person. Actually, I was eating a tobacco and I was eating a lot tobacco. So in 2014, I had a tumor behind my right ear. And I went to, at that time, I didn't think that I'll be having a cancer. So I went to my cousin who's the general surgeon and I showed him. He said, okay, because he was a general surgeon and he was also eating a tobacco. So he said, okay, there is nothing to worry. I'll operate it and get it done. Don't worry. Come to my hospital tomorrow and we'll finish this. So I went to his hospital. He operated me. I stayed there for 3 days and everything was normal. Then after 6 months, again I had a tumor. So I went again to him. He said, sometime it happens, it reoccurs, don't worry. Again, we will remove it, then you'll be perfectly okay. At that time, my father specifically asked him because he is my cousin. So my father is his mama. So he asked, is there something serious, something like that? He said, don't worry, nothing is to worry. He will be perfectly okay. So again, I went to his hospital. I was operated for 2, 3 days. And then I came home. After again 6 months, I had a tumor, and this time it was a little bit bigger than the earlier one. So I decided I'm not going to consult him. So I talked to my MD where I am doing job right now. He is having a close friend. He is a oncologist in Ahmedabad. So I requested my MD that I want to consult that oncologist for my this problem. So he said, okay, don't worry. Then he called him and took the appointment for me. And I went to that oncologist and he said, okay, you are such a big full person. Because 3 times you had a tumor and still you are I mean, very easy. I said, "Okay," but I was not serious about it because my cousin cannot say lie to me. She said, "Don't worry, we'll go for some kind of investigations and tests." So he recommended so many investigations and tests. So I went for a sonography and PET scan and whatnot. Uh, After 24 hours, all the reports came, and the report was saying that okay, you may not be. So I asked that doctor that what do you mean by may not? He said, okay, 2 times this area was operated, so it's very difficult for even the system to 100% diagnose that this is a cancer. But it seems like cancer. So I went again to that oncologist and he said, okay, now we have to go for a biopsy. So I asked him, what is biopsy? Like Tamanna ji, even I was also not knowing what is biopsy. They said okay, they are going to inject one needle in my neck and they will pull out some kind of material from that tumor. So it was a very long needle, not a normal needle, and it was little bit thick needle. So I was right from my childhood, I was scared about the injections. So I said, "Okay, I don't want to go for this." They said, okay, there is no other alternative. Then I said, okay. So without giving anesthetic or anything, they tried to, pull this material, but they were not successful for the one time. So they said, let's wait for 10 minutes. Because of fibrosis and all these things, the material is not coming out. 3 times they tried for pulling out that material, and finally they said, okay, no, it's very difficult for us to get the enough material to test whether there is a cancer or not. Then again, I went to that oncologist, and he said, then there is no way out. Then we have to go for some kind of consultation to surgeon. So he sent me to one surgeon. I went there. That surgeon was a very knowledgeable, very smart. But I don't know somehow, but his hospital and the ambience and the environment was uh, not good. I mean, I didn't like that hospital and all these things. So I again came back to my MD and I told him that I want to go to this surgeon. Is there any other surgeon? Because somehow I am scared and I don't want to go there. So he again talked to that oncologist who is his friend. He said, okay, then there is a one hospital in Ahmedabad. I am sending him there, but it is little bit expensive, but they are the best doctors in Ahmedabad. So I was sent to that hospital, and the one of the best surgeon in India. I mean, I was lucky to have him there. So I went to him and he examined me and he said, okay, there is no way out except surgery. We have to go for the surgery, otherwise nothing is going to be diagnosed because of earlier two operations. So I asked him, do I have cancer? He said, okay, mostly yes. But right now I cannot say anything because there are other lymph nodes also in your neck. So I mean, we cannot say 100% right now. Surgery is the only option. So I said, okay, let's go for the surgery. Till then, I was normal. But when, I was approached by the general physician and he started examining me for the operations, then I was losing courage, losing courage, losing courage. By the time at 7 o'clock in the evening, I was almost, down. I was not even able to walk or not even able to speak to my wife. She asked so many times, "Okay, are you having some problem?" I said, "No. Mentally, I'm down. I cannot go for the operation tomorrow." She said, "Okay, don't worry, nothing is going to happen to you. Let's go home. We'll have a good dinner, and tomorrow you'll be having a good operation." So I could not sleep the whole night on that day. I went at 6 o'clock to the hospital for the operations at around, and at that time, before the operations morning, my MD called me last night and he said, "Don't worry, nothing is going to happen to you. Just go to the operation theater and tell that doctors that I have to go back to my family. So finish it up and send me back." And that, that sentence helped me a lot. And in the operation theater, I was very normal. When I told to that doctor, the operation theater in charge doctor, he said, "यार किस टाइप का आदमी है यार, नॉर्मल लोग यहाँ आके घबराते हैं, तू बोलता है कि मुझे वापस जाना है." I said, "No, boss, this is the only, strength, my strength." Then the operation started and it took 8 to 9 hours because they operated me. Then they took some lymph nodes also from my neck. And during the operation, they sent that lymph nodes for biopsy, whether there is a cancer inside the lymph nodes or not. If it is, then they said that they are going to extend the surgery. But fortunately, the all lymph nodes were normal, so they only removed the parotid gland and then they finished everything. I was taken to the ICU after operation, and around me all the patients were there. So I was so scared, and I started shouting, "I don't want to stay here. I don't want to stay here." Then ICU in charge doctor called the other doctor and said, "Okay, this guy is saying like this, but it seems that he is a better." So they said, "Okay, send him after midnight if he is feeling better. Otherwise, keep him in the ICU." So around 3 o'clock or 4 o'clock in the morning, I was transferred to the room. Then I was for 7 days in the hospital for treatment. And during the treatment, gradually I was losing, my courage and everything. So after, 7 days, the Diwali festival was supposed to start after 2 days. So my wife specifically requested the doctors that, "Can we go home because we have our festival and we are Hindus, so we don't want to stay in the hospital. We want to go home." So doctor allowed us, but they said that daily he has to come to the hospital for this thing, dressing and all these things. So I was going there when you know the duct and everything was removed from my body. Then they said, "Okay, now you can start eating, but don't eat hard food. Initially, you have to eat soft food and take a more liquid." So I'll finish up now. 5 minutes, don't worry. Then the crucial part of my cancer started after that operation. Then gradually I was down, down, down. I was not going to my office. I was not talking to anyone. I was not meeting to anyone because when to whomsoever I was meeting, they said, "Oh, cancer." They in Gujarati earlier they were saying cancer means cancel. So and people were giving the example of their relatives or their friends कि इसको ऐसा हुआ था and he didn't survive. इसको ऐसा हुआ था, he didn't survive. So I stopped meeting everyone. I stopped going anywhere. I was not even attending my office. One day I had a follow up in my hospital, and that a lady doctor was there. She was on maternity leave during my operation. Then she resumed her duty. So my wife opened up with her and she said, "Okay, ma'am, he is not even meeting, not even talking, not doing anything. What to do?" She said, "Don't worry, Mehul bhai, nothing is going to happen. You are perfectly okay." Then after 3 or 4 days, that doctor called my wife and she said, okay, we have a one function in Ahmedabad, so you must send him to that function. And there she introduced me to Shrenik Bhai and other cancer survivors. When I saw Shrenik Bhai, when I saw Shrenik Bhai, my goodness, I gave up everything, my scares, my डर, सब कुछ छोड़ दिया. When I saw Shrenik Bhai, I said, "Okay, when this man is living his life, I can very easily live my life." And that was the biggest turning point in my life. And thereafter, started my office. I started my dance practice again. Thereafter, I performed so many programs in Ahmedabad as well as in India. And I was a winner in my company's sports event also for badminton tournament. And still, I am doing at least 10 to 11 hours job right now, even today also. So, thanks to my that doctor, lady doctor, who's always smiling and helping, and thanks to Shrenik Bhai, who took me out from this, biggest, my, say, fear or scaring, everything. Thank you, everyone. Thanks a lot.
Thank you. Thank you, Bye. Thank you so very much. Well, I just did my job, which I'm doing for everyone, and you are really a commendable warrior. Uh, I don't think I will have any questions. Maybe we would be rather running out of time. Yodaji, if you would like to speak. And well, I mean, here the light went off, so there is no electricity, so I am sitting a bit in the dark. Please continue.
No, I think Mehul Bhai's story is very inspiring. I think at some point, Shrenik Bhai, you need to call that lady doctor on your program also.
Madam, she was there. I mean, Dr. Murvi Patel, she was here on our platform some months
Oh,
back.
yes, yes, yes. You didn't tell us the
Yeah,
name, but yeah, certainly she
yeah,
was here. Yeah.
Dr. Murvi Patel, yes, she was there.
Mm,
So, I mean, commendable and
yeah.
smiling oncologist
Ah,
as always.
very nice.
Uh, yeah, Madam, we are rather bit running out of time. I would like to invite the next speaker. Uh, once again, Tujanbai. Please, I mean, Tujanbai is again a vocal cord cancer survivor like me, and as I mentioned, is a farmer and is speaking with the electronics like what I am doing. So, Tujanbai, unmute yourself. Tujanbai, unmute करो ने તમે વાત करो.
Sir, Tushar is not here.
Probably might have left or he might be having some maybe internet issue. Let me check 1 second.
Okay, sir.
I think I don't find him either on the phone. Maybe he might be having a network issue. So friends, what I want to share with you a very important note based on experience of Mr. Mewtra that when it comes to something serious, you know it is always important to consult the cancer specialist instead of taking trials and error and getting rather than getting connected or taking treatment from your relatives or etc. Because I mean fortunately we could manage, but then it's like playing shot in dark. So don't take such kind of risk at any point of time. Life is very precious and it is imperative. Yes, it is compulsory, obligatory to consult the cancer specialist wherever you are living and I mean protect your life and stay committed, stay survived and follow all necessary treatment protocols. And as always, I am saying in all my conversation, if you are not medically qualified, simply don't browse details on browsers and better consult the cancer specialist wherever you are and follow all necessary treatment protocols. Yodha madam, I mean, if you would like to add something.
No, Shrenik Bhai, I think Mehul Bhai has said it all, that you have to consult a proper specialist. You have to leave eating tobacco. That has to be, emphasized.
Yes,
And the
absolutely.
and the attitude of your doctor makes a huge difference. Both Tamanna, who made her oncologist laugh, and Mehul Bhai's oncologist made him laugh. Good luck and thank you to all the doctors who work in that spirit.
Thank you very much. And thank you all attendees and all speakers on behalf of Indian Cancer Society and wish you good health throughout the year and for years to come. Thank you. God bless everyone. Bye bye.